Hello, everyone, and welcome back to another episode of Clinically Speaking, the podcast where we dive into the conversations shaping therapy across Ivy. I'm your host, Marie Neri-Cossia, and today we're tackling a topic every clinician uses daily, ICD-10 coding, and what's new as we move into 2026. Joining me are two incredible guests who bring both clinical and operational expertise to the table. First, we have Marie Neri-Cossia, a certified coding specialist with over 30 years of experience in medical billing, coding, and compliance. Anne Marie has worked across multiple therapy disciplines, physical, occupational, and speech, helping teams ensure accurate documentation and reimbursement while supporting clinical excellence. Also joining us is Stacie Delezene, Director of Clinical Excellence at Ivy Rehab for Kids. Stacie is a passionate advocate for children, families, and clinicians alike, leading initiatives that elevate evidence-based practice, interprofessional collaboration, and lifelong learning across our pediatric network. Together, we'll explore how ICD-10 coding supports better care, the updates every SLP should know, and how Ivy Rehab empowers clinicians to make confident, informed decisions for their patients. So let's jump in. Can each of you share your role and what drew you to pediatric speech language pathology?
Would you like me to go first?
Yeah, go for it.
Okay. I've been drawn into it. I feel I want to help those clinicians deal with the complex world, like they're dealing with coding, documentation, and payer requirements. And I want them to understand that they're doing it for the patient. They're not just doing it because they have to do it.
Yeah, I love that, Anne-Marie. So I am a speech pathologist, as you mentioned, Biz, and I'm currently one of the directors of clinical excellence for our pediatric teams. I've honestly just always loved supporting others through that professional growth, through interprofessional practice, guiding clinicians to feel confident in making the best decisions for quality care. Personally, I just love seeing those positive changes that we can make in the lives of children and their families. And, documentation is that way to paint the picture and really demonstrate your value and advocate for the quality care that you've given.
Strongly agree on that.
Yeah.
Beautiful answers. Thank you both. We always say it's all about the people, it's all about the patients. So couldn't agree more. And why do you think coding is such an important topic for SLPs right now?
Coding is an important topic for them because it helps landscape it helps them landscape the healthcare and have them understand how they have to go through it. SLPs are being asked to do more work today. They're asked to do more accurate documentation. They're, asked to bill more. So I feel like if we could help them train on coding and understanding why, it would be less pressure on them. And they'd understand that we're not trying to ask more of them. We're just trying to guide them to do it correctly and make it a lot easier.
Yeah, and I think just understanding the why behind coding rules really just empowers them to document effectively, accurately, and really just making sure that what we're providing is clear in the documentation. So really just, again, build that confidence. And, to Anne-Marie's point, healthcare is ever evolving, and unfortunately rules don't ever stay the same, even in the world of coding. So I think just, again, understanding the why behind those rules and helping them build that confidence to do it accurately.
Thank you. So let's dive into that why. So Anne-Marie, can you explain what ICD-10 codes are and why all disciplines, including SLPs, use them?
Absolutely. So ICD-10 codes is a short term for the International Classification of Diseases. So as you know, we are in the 10th version of it. We changed about 7 years ago from ICD-9 to ICD-10. The point of that was we wanted to try to make diagnoses more specific so the payers could be universal. In simple terms, these codes just tell a story of why the service is being provided. For example, while a CPT code describes what the patient's being treated for, the ICD tells them why they're being treated. And it also is universal. So if a doctor needs to see it, if a patient's asking, what's the diagnosis. It's universal and it goes across the board. It helps payers. So that's the reason why behind it. It's not just a number. Like, we think of it as just a number, but it's not a number.
Yeah, it's kind of that universal language, right, Anne-Marie? All healthcare disciplines, speech, researchers, payers, providers all have that common language when it comes to, that code that describes what their diagnoses or their medical condition.
Right. It's not just a number behind it. There's some reason for it.
Yeah, like Stacie said, a universal language makes it so interesting and intricate. And how do medical diagnosis codes help SLPs understand what a patient might need for treatment? Anne Marie.
Diagnosis codes usually do more than just support billing. They help paint the picture of why a patient needs therapy. It helps them by understanding the diagnosis. It helps the SLP. They can focus on their treatment plans, on their goals from the start to finish. It also keeps everyone, therapists, physicians, billing, and the billing team on the same page to make sure that the therapist are billing what is medically necessary and what is truly supporting the patient's needs.
Yeah, and I think just to add from an SLP perspective, understanding the underlying diagnosis can really help SLPs decide what interventions and what therapeutic approaches may be best to target in therapy. Again, just knowing that medical diagnosis can help us deliver the highest quality of therapy when working with the child and the family to really target the goals that are most meaningful to them.
And how does ICD-10 coding connect to treatment planning and long-term discharge planning?
Yeah, I can take that one. So, as Anne-Marie mentioned before, just again, having an understanding again of that underlying medical history or any current diagnoses really can help us deliver the appropriate, most effective care. It'll also help us work to provide the best prognosis when we work towards delivering those sustainable, positive clinical outcomes. And as patients make progress, their diagnosis codes may change or resolve, which helps support decisions about continuing, modifying, or even potentially working towards discharging from therapy. So again, just that accurate coding not only supports the documentation and reimbursement side, but it also reflects the patient's journey from eval to, again, those successful outcomes.
Right. I agree. And it's also nice to see how the patient has started and how they have progressed to a more positive outcome. They may have come in as something chronic, but now it just might be acute, which is nice, where they can come back periodically and be treated.
Yeah, every scenario is a little bit different. So just kind of looking at the unique needs of that
Yes.
individual.
Thank you both. And then shifting back to what ICD stands for, which is the International Classification of Diseases, can you talk more about that and how it's updated every October and how we just received an update on October 1st? But I would love to hear more about that, Anne Marie.
So CMS, which is Center for Medicare, every October 1st, they do updates on the coding. That is then sent out to ASHA and anybody else. How it affects therapists, the hardest part for them is they don't really know, what codes are. So we behind it will research it. We will make sure we send out updates for them. So they're not documenting codes that are invalid. They're not getting denials. They're not have to worry about any of that information.
Yeah, and I think just, like she said, every October 1st, there's those updates, and those updates might include codes that are revisions to existing ones or even deletions of outdated codes. So staying current is important because using an expired or incorrect code could lead to, denials, compliance issues, impact coverage. So for SLPs and other therapists, just being aware of those yearly changes can help ensure that we're coding the most accurately.
Yes, correct.
Okay, and then how does Ivy as an organization track updates and guide clinicians on best practices?
I can jump in there, Anne-Marie. So I know Ivy Rehab, we really emphasize the importance of our SLPs just again being lifelong learners, and that includes CEU offerings, professional growth and development opportunities, and we even offer a pediatric SLP residency program to really advance that clinical practice and work towards different specialties. So we also have a lot of internal clinical resources, including Anne-Marie, for example, as our coding specialist, really to guide and direct those best practices and keep us up to date. But again, allowing our SLPs to take on some of that ability to be lifelong learners as well.
Right. And it also gives them an opportunity to grow and develop as well when they're with us.
Yeah, which is great, which is one of our values, growth. So it's amazing that we provide these opportunities to all of our clinicians.
Yes.
And then what are some of the most common CPT or ICD-10 codes that you see in pediatric SLP practice?
So most common would be like for speech language communication, it's just a one simple code. It's 92507.
Mm-hmm.
And then 925256, which is just feeding. That's a very common code. There are not many codes used, which is very nice for them. So it makes it a little easier for them to concentrate on patient care than what they're coding out. When it comes to the opposite side of it, for more of the diagnosis, they use a lot of the R31.1, which is dysphagia. They're using a lot of them R63.61, which is chronic feedings, and then the R63.62, which is chronic feeding. So for them, they're very lucky that it's not a wide variety of codes, and they do have a great specialty. I mean, it is great to specialize in just one thing, which I think is great for the patient.
Yeah, I think you have, SLPs, you have a handful of evaluation codes, treatment codes that we use for billing. Those are your CPT codes. Anne-Marie mentioned one of the most common for treatment intervention is that 92507. Then on the flip side, for the ICD-10 is more of that common language, right, for medical diagnoses and conditions. And as she mentioned, we see a lot of pediatric feeding. We see a lot of language, language delay, things like that. But these codes, they just help us to support, again, that medical necessity. And again, more specific to pediatrics, we might see more of that mixed receptive expressive language disorder, maybe some speech articulation, fluency disorders, things like that. Certainly not an all-inclusive list, but
Right.
some of the most common that come to mind in this moment. And at the end of the day, every child and every family is unique. And no matter if they all have the same ICD-10 codes or CPT codes, every case is still very unique. And we want to make sure that we're delivering that individualized family-centered care, no matter what, because each kid is different in their own right.
Agreed.
I know it's amazing to hear the attention to detail that goes into this, and how well we take it seriously. So it's amazing to hear. And I know we've briefly touched upon this already, but can we hear more about the differences between medical codes, the why, and treatment codes, the how, in your documentation?
I think the best way to explain it would be medical codes, which would be the ICD-10 codes, explain why behind therapy. They describe the patient's diagnosis, the condition, like a language delay or swallowing disability. There are also treatment codes, that would be the CPTs, that explains the how. They detail the services provided by the speech therapist, if they're doing cognitive therapy, if they're doing language intervention. So by clearly documenting both of them, it shows the connection between the patient condition and the therapy provided. And this is not only supporting medical necessity, but it also helps to accurate billing and reimbursement for us.
Yeah, and I think just to expand on that, the ICD-10 has medical codes and ICD-10 treatment codes. The treatment codes, they correlate to goals and interventions that you're providing as an SLP. So if I could think of an example, let's say a child may have a medical diagnosis from their primary care physician, but the plan of care may include SLP-related goals that target motor speech. So my treatment diagnosis may be, after my comprehensive assessment, is apraxia of speech, for example. So my treatment diagnosis for ICD-10 will correlate to the goals that I'm providing from a speech perspective.
I do love how Stacie can explain the code from the clinical aspect of it, because you're the clinician where I'm just the coding part. So it's kind of nice to hear how it really works towards the patient's care.
Yeah, it's interesting to hear both perspectives.
Yeah, it's different when you're on the opposite end, because you always think of it as a number, or to get reimbursed, or making sure the patient gets the proper care. But when Stacie explains it, you hear it how it's actually based on the patient, not just that code or diagnosis.
It's so important to think of, each individual as their own unique person. And honestly, that's why we do what we do, right? I became a speech therapist to help people, but, I do have to know this side of it, and I have to know the coding aspect and how it all correlates. Again, just being able to paint the picture of that case for all the stakeholders involved. But yeah.
Yeah, beautifully said, Stacie. Thank you. And then lastly, in this section here, so why is specificity in coding so important, and what challenges come from general codes like those ending in 8 or 9?
So that's a big issue. So remember, when we had ICD-9, it was very general. ICD-10 came apart, and it was supposed to be more specific. But I think a lot of us got stuck in our ways and used to codes that work. So when we're coding an 8 or a 9, it's an inconsistent billing. It's an either a other or it's unspecific. For example, it's just too vague of a code. So a lot of insurance companies will deny it. It draws audits to us. And a lot of payers will start questioning, why are we using them when we were trained on using the newer, more detailed codes. So that's what we're doing on our side. We're trying to do a lot of auditing and training with therapists just to show them it's okay to use it. Listen, if that's all you have, it's perfect. But if you can be more specific, it helps that patient along the line, because it also helps them in the community. That diagnosis, the more specific it is, also can give them more community support.
Thank you, Anne Marie. Now, moving into coding in school and early in your career, Stacie, can you share with us how much exposure to coding do students typically get in grad school?
Yeah, and I just want to acknowledge, I'm sure there are varying levels of exposure. So all I can speak from is kind of my knowledge and my experience. Historically, I have supported several graduate level SLPs and also clinical fellows early in their career. And coding is often an area that clinicians have a lot of questions about. And to be honest, clinicians have questions about this no matter their level of experience. Even I have questions regularly about it, and I think that's a good thing. You want to be asking questions. You want to make sure you're doing it accurately. At the end of the day, I really just like to ensure that they understand the importance of being an accurate coder and overall just having good documentation, good quality. Again, just being that committed to learning, asking questions, knowing some of the reliable resources when they do have questions going forward, and just staying up to date and current with best practices is really the key. But again, I think if you don't have questions about coding, kudos to you, but I would say most people do regularly.
I agree. I have questions on coding. I think
Yeah.
that was a great question, Ms. Marie, because if you don't, you have to train me. That's great. Even I have questions, and we don't want the therapist also to be scared to come to us. We're here.
Mm-hmm.
So if you have a question, come right to us.
For anyone listening, don't be afraid to ask questions.
Yes.
Yeah.
Listen, I might not have the answer this exact moment, but we will definitely figure it out and get back to you.
I love that. Thank you, Stacie. And how do externships help new SLPs learn about ICD-10 and CPT coding in real clinician settings?
Yeah, I think the great thing about externships and even that clinical fellowship year, especially at Ivy Rehab for Kids, is that you are connected with an experienced SLP who can be a guide, as well as share, again, those trusted resources for that SLP who's just starting out in the field. At Ivy, our SLPs have access to a variety of not only internal but also external clinical tools, people, networks. Again, I mentioned those educational opportunities just to ensure that questions are met timely. Um, and that certainly includes documentation excellence and accurate coding. Um, Again, I just really want to reiterate that we don't ever want to say these are the codes you should use. We want them to have the confidence to understand why and empower them to have the ability to make those clinical decisions about the care that they're providing and the documentation that they're owning. So, again, just kind of guiding and directing best practices and empowering them to make those decisions.
Thank you. And this is for Stacie or Anne Marie. At Ivy, how do CFs and mentors support new clinicians in developing their coding and documentation skills?
Yeah, I think I kind of mentioned it even in that last one. The question was specific to students and clinical fellows, but those same exact resources are available for all of our teammates, not even just SLPs. You know, we work collaboratively across many disciplines here at Ivy and Ivy Rehab for Kids. So, all of those tools are available for all of our teammates, no matter where they are in their career.
Thank you. And just those are some of the benefits at working at Ivy, and it's truly amazing what we can do for our clinicians. So thank you. Now, kind of going into the common pitfalls and frequently asked questions in coding, why might overusing R codes, symptom codes like R47.0 create challenges, Anne Marie?
So an R code describes symptoms rather than the actual diagnosis. So as you said, the R47.0 indicates just a speech disturbance.
Mm.
So it's just telling you the patient's symptom, not why they're being treated. And I feel like if the therapist continues getting used to it, it becomes overused and then creates a problem. The main challenge is that the payer often will see it so much that it draws a flag to them. And in their mind, it's like, well, can every patient they're seeing have that same code? And it also brings it back to us coming into ICD-10, where we need to be more specific on why that patient is being seen.
Yeah, and I think I'll just expand on that. Obviously, ICD-10, CPT codes, that's one piece of your documentation. So again, you have to have all those pieces, the reason for referral, the medical necessity, strong goals and your assessment findings. Again, more than that, but again, you're painting the picture of that full case to justify the interventions and then also to demonstrate your value as you continue to see them.
And what resources do you recommend for clinicians who want to double check any coding decisions?
There are several out there. Number one, they can come to us. ASHA provides coding guidelines. They do a lot of webinars. They have updates, and they're very specific to speech language pathologists. Due to the fact that it's pediatrics, they could use CMS website because, as you know, it's more adults, but they are also the basic guidelines. So if they're just looking to confirm or reaffirm that they're using the right code, they can use their website as well. Organizations like we provide guidelines. We try to do a lot of training. We're trying to create templates now. I know for incoming ones, we want to start training. So there are multiple resources that they can come across. So they don't have to just, even checking the web these days, we can just Google it and see. And then if they feel like it's a code they're unsure with, come to us. and we can confirm it, or we can help them, give them a better code. For me as a biller and a CPC, I can't tell them what code to use, but I
Mhm.
can kind of help them direct what might be a better choice.
Yeah, I
Thank
think the
you.
key there is just looking for those reliable sources. Obviously, Ivy, does our best to make sure that we are guiding and directing their ability to have confidence in their decisions. But there are several credible external resources that we also encourage use of. Just cross-checking, checking for updates. I think that's the key.
Thank you both, and thank you, Anne Marie, for being a resource for teammates. I think that's incredible. So thank you for the work that you do and the help that you give.
I try.
And then diving into compliance, payer perspective, and care planning, why is having quality documentation important to you?
So I'll start, but I'll have to admit, Biz, that is a big question. There's many reasons to ensure quality, accurate documentation. If I were to sit here and to think of a few that come to mind now, I would say that quality documentation helps me support my clinical decision making and making sure that that's clearly documented throughout the case for that individual's interventions that I'm providing. It also helps enhance patient safety because that's that record to reduce risk by ensuring all staff have essential information and that I'm communicating for, maybe a PRN therapist that comes up and takes over that case for that day. Um, it also helps ensure accountability and compliance through that comprehensive documentation, meeting the requirements of um, all of the compliance standards that we have to stand by. It also, Anne Marie keeps mentioning that justification of care. It really does validate that service and demonstrates why they need therapy, why now, and just making sure that again, I keep saying paint the picture, but truly that's what it is. You want to be able to pick up that whole care, every document that I've submitted, and be able to clearly see what I've done, what's worked, and make sure that anyone that picks that up can really understand it.
So I'm going to give you a saying we have in the billing world. If it's not documented, it didn't happen. So we used to tell that a lot to our physicians. They would say, well, this is what I did, how I did it, why I did it. If it's not documented, it did not happen. So our documentation demonstrates medical necessity. It justifies the services that were performed by our therapists.
Mhm.
It shows transparency. It shows the family members, if they ever want to request medical records, what work was done. If we ever need to fight for that patient for insurance wise or other benefits, it was documented.
Advocacy. Yeah, that's important.
Yeah.
Very important. And how do these comprehensive assessments help clinicians determine the appropriate treatment codes in their plan of care while staying within proper coding guidelines?
So, for me, a comprehensive assessment to develop a plan of care is really best practice. That includes leveraging both formal and informal measures. Obviously, family input, very important. A comprehensive assessment is helpful for many reasons, but one reason is the proper development of that plan of care, which includes accuracy in both ICD-10 and CPT coding selection. So again, a comprehensive assessment can really help to ensure accurate SLP treatment diagnosis. So being able to identify type and severity of a certain speech or language disorder, for example, um, using it also helps by using standardized and informal measures, as I mentioned, kind of that combination of both to develop that full profile. It also allows for alignment with that medical necessity and also coverage. So those codes must reflect that and comply with payer guidelines. It also helps with creating, again, that individualized family-centered therapy plan. Um, and that will help drive the decisions we make about the interventions, our approach, prescription, how we're providing care, things like that.
I will say that was well said, Stacie. Well said. I even learned from that one.
Oh, good.
Love to hear it. And can each of you share examples of the most common conditions seen, like expressive or receptive language disorders, fluency, pediatric feeding, or developmental speech language disorders?
Yeah, so again, at Ivy Rehab for Kids, we work with children that present with a wide range of diagnoses, and that can include receptive expressive language delays and disorders, autism, childhood apraxia of speech, fluency, pediatric feeding challenges. I'm sure I've missed, those are just a few that come to mind. But using that accurate diagnostic code is essential to capture a clear and complete picture of each child's needs, their goals, and even their family priorities. Again, while a child may initially be referred for one concern, such as, let's say, language delay at age 2, as their communication skills develop, it may be appropriate to incorporate additional codes and update that plan of care, maybe adding articulation or feeding as some of those other milestones come. And again, that just ensures that we're accurately representing each child's, again, their profile or that plan of care, and highlighting that comprehensive individualized care along the way. Because again, we're always ongoing assessing throughout to make sure that what we're doing is effective and justifying that through documentation.
Yes, and I also feel that, as you stated, as their care changes, if the SLP isn't sure of the best time to change the code, or should it be a primary code or secondary code, it's also great to reach out to us, because sometimes that primary code, which what they came in for originally, is not needed anymore. But we also don't want to lose that code. So we want to make sure that when they're coding it in the proper order.
Yes, having that flexibility to adapt and, again, just kind of do what's needed at that point in time, but again, using that clinical lens along the way.
Yes, absolutely.
Great, thank you both. And then now diving into an event that is coming up next
Right.
month, ASHA. So, can we talk a little bit about what is ASHA and why is it such an important organization for SLPs nationally?
Yeah, so ASHA, we've mentioned it a couple times, even in regards to resources for coding, but ASHA is just the American Speech Language Hearing Association. It's the national professional organization for SLPs and audiologists. It really is that national organization that helps sets our professional standards, provides certification. If you hold your certificate of clinical competence through them, they advocate for our profession, again, at that national level. And for SLPs, ASHA really is a valuable because it offers, like Anne-Marie said, coding and billing resources. They help provide continuing education opportunities and track them for us. They have clinical practice guides. They help with policy updates. If I'm looking to have someone help advocate for something that might be coming that may impact our profession or the care that our those that we serve get access to care, then they're definitely leading the charge a lot of times for that advocacy. So just making sure that we as SLPs are being connected, not only at that grassroots level or that local level, but also at the national level through organizations like ASHA that helps our clinicians stay informed, and just really helps us provide that high standard of care.
I have a question, Stacie. Does all of our SLPs have to be certified through ASHA, or are there other organizations?
Yeah, so that's a good question. Some states do require you with their licensure to have their Cs, but that can vary state to state.
Okay.
Mm.
It is something that we recommend at Ivy is to have for a variety of different reasons, but obviously advocacy is a big part of that, and some of the resources they're available to you whether you're certified through ASHA or not.
Okay.
Thank you, Stacie, and thank you for the question, Anne Marie.
Sorry, I was just learning so much as she was speaking. I was just wondering.
Yeah.
No, I love it. I love to hear that we're learning on the podcast. That's what makes it great. Yeah. So I know ASHA is also celebrating its centennial anniversary this year. What does that mean to you, Stacie and Anne Marie? How has ASHA impacted your life?
Yeah, I know that with convention coming up in a couple weeks, I'm sure that'll be a big part of this celebration is celebrating that organization's centennial anniversary. But I can only speak for me personally. ASHA has been valuable.
Mhm.
Its leadership in clinical standards, its advocacy, its opportunities for professional development and getting involved, really their commitment to evidence-based and equitable care. Again, personally, that's something that I've reflected upon and value with them. When I'm looking for information specific to our profession, that's usually one of my first stops.
Yeah, I agree on that. I do, if I'm stuck with a coding issue or something I can't figure out, I do like accessing their website, which allows me to explore and it kind of helps me figure out the best answer. So I do like that they are open to everyone to use just to
Mhm.
get some knowledge.
No, that's fantastic. And it's great to know. So if those listening were not aware, now you know, and you can log on at any time to research anything you're curious about. And we did mention that it is coming up next month. So ASHA will be on November 20th through the 22nd in DC. What are you most excited about, Stacie?
Yeah, so Ivy Rehab, we will be present at the annual convention coming up in a few weeks. There will be many Ivy Rehab for Kid teammates, clinicians, and leaders there to support our profession and also to network with other attendees. The annual convention is exciting every year. Every time I leave there, I feel just refreshed and excited to have new tools in my toolbox or maybe new connections that I've met. I just love learning about better ways to help those that we serve. And it's a great opportunity to bring back, again, those tools and share them with other teammates within Ivy. So I just look forward to it every year. It's so many. A lot of breakout sessions, no matter your interests. There's poster sessions. There's a sponsor like a place to network with all the vendors, a vendor fair. There's seminars that are up to 2 hours, I believe, and then an hour long 30-minute sessions. So a lot of continuing education opportunities.
Hmm. And are there any sessions or speakers that you're particularly excited about?
Yeah, so I was just looking at their online program planner on their site a few days ago, and it can be so many offerings that it can be kind of overwhelming. So everyone has their own unique strategy of
Mm.
planning their day, because sometimes there's more than one session that overlaps with another that you are interested in. But I always like to look at the invited speakers first. From there, hearing about what's up and coming in our field, as well as practical takeaways that can be easily implemented into treatment sessions. Those are kind of what I'm drawn to. So hearing about research that's innovative, but also like what can I take and do today? Those are my favorite sessions. There was one specific to AI and AAC that stood out.
Mm.
Hmm.
There was another on building basic counseling skills, and I felt like those were two that I find are often needed in our setting. So those are two that I had my eye on initially, but still have some planning to do.
Oh, they sound so interesting, and it's so exciting that they offer so much, during that weekend because it feels, how you're that feeling of leaving and feeling refreshed, like you've just kind of gotten all this knowledge. So I'm excited that's exciting for the team. And let's say you're a clinician attending ASHA for the first time. How can they make the most of their time, when it comes to networking, education, exploring the resources? I would love to hear your tips and thoughts on that.
Yeah, so it's not often that you have that many SLPs and audiologists in the same place, thousands of us that attend every year. So if it's your first time, I would just take time going through the vendor section. It's a great way to network, and that includes more than just collecting all the pens and swag that can be fun at every booth, but stop at the booth, ask questions, get curious. A lot of times I'll make connections with companies or vendors
Mm.
or places like Ivy and realize that wow, there's opportunities out there that I didn't even know existed or that I would be interested in. But um, On top of that, I really do enjoy the poster sessions. It's another great way to gather information in a short period of time, and it also allows you to engage more with the author or the presenter because they're right there and you're kind of talking one-on-one to them or with a small group. So definitely love the longer sessions, but the posters and the vendors can be a fun opportunity too.
Great tips. Yeah, thank you,
Do
Stacie.
you take home a lot of swag while you're there?
There is a goal, but sometimes you're limited on your
Oh.
luggage space, so you have to be
Oh, okay.
strategic.
Okay. I thought you were limited on what they would allow you to take.
No, there you would love how much swag is there, but
Oh, swag is always fun. I love swag.
I know. I was just wondering how much. I hope Ivy brings a whole bunch. So
yeah, definitely.
Yes. Now, how does Ivy's presence at ASHA reflect our commitment to clinical growth and education?
Honestly, and I may be biased being in the clinical excellence department and a director of clinical excellence, but I truly believe that one thing that sets Ivy Rehab apart is our commitment to clinical excellence and really just encouraging, again, that lifelong learning, networking, trying to practice at the highest level. Each and every day is really what drives quality, and that's what's going to make the most impact to those that come through our door and are allowing us to help them. So just being there, I think, again, just shows how much value that they have and their commitment to that.
Amazing. And I love our clinical excellence team. Stacie, you and the team do an amazing job.
Like I said, I may be a little biased, but I would agree.
never.
And lastly, how can attendees tie what they learn at ASHA back into their coding practices and clinical work?
Yeah, so again, Ivy will be at ASHA, so definitely stop by the booth in that main exhibit hall. A lot of our teammates will be highlighting our pediatric services and the career opportunities through branded interactive booth. And it really reflects Ivy's culture and our commitment, again, to clinical growth and clinical excellence. They'll be having some fun giveaways and engagement activities designed to just spark good conversation. So I would definitely encourage you to stop at the booth and really hear more about what Ivy has to offer beyond coding what you've learned today.
Thank you, Stacie. And now we have 2 more questions, and we do have some questions in the comments. So after these last 2, we'll then go ahead and take a look at the comments and answer a few of your questions. So any final advice for SLPs navigating ICD-10 coding for 2026?
My advice is to stay current, which is sometimes extremely hard. Be specific. Diagnose the best code you feel confident that helps that patient, and use the resources that you have at Ivy. I mean, we're here for you. You have an amazing, clinical excellence team. How many other facilities can state that? Make sure you clearly document. Like I said, if it wasn't written, it didn't happen. Try to use the most specific ICD-10s. And if you're lost, we're always here. Try to avoid a lot of those codes that end in 8 or 9, only simply because they get denied or they don't give the patient the proper diagnosis that they really should be getting. And take advantage of ASHA for CMS. I mean, AI is now out there. If you feel comfortable, take advantage to any kind of research you can get.
I would just say, I think things like coding, people love black and white, and it's not always black and white. And, we can't tell you what to do. You have to be empowered to understand the why behind certain practices or decisions that you're making. So, to Anne Marie's point, just leverage your resources, be willing to ask questions to understand, and just try not to let it overwhelm you. Because again, I would guarantee you're not the only one who has questions with coding. It's ever evolving and changing at times, especially as we continue to be more specific. And so I would just say, don't let it overwhelm you, and it's okay to have questions.
I agree.
Yeah.
I agree with that.
Oh, beautiful answers. Thank you. And lastly, for today, what's one actionable step clinicians can take this week to review their coding specificity?
I would just review and just double check and remember nothing is ever wrong. We can always change it. So if you're unsure, use it. But if you know you can contact one of us, you can reach out, do it. But remember, it is a number and we can always change it and correct it. And if you can tell us what your need is, let us help you so then we can train the new ones coming in to understand as well.
Yeah, I agree.
Just take 15 minutes, just, review it. It just, I mean, and not that you have 15 minutes. I understand these therapists are so busy, but there's never a wrong. Nothing was wrong. It can always be corrected, but just take those few minutes just to review to make sure you gave that patient
Mm-hmm.
the best opportunity for care and treatment.
Amazing. Thank you both so, so much. I am taking a look here in the comments. So we have one that is asking about any specific payer, which was earlier in the call. Is that a question we can answer, or would we need more information for that one?
I don't know what they're asking, but
Yeah.
every state has their own rules and regulations. Every payer has the same rules and regulations. Some payers will accept a code, some will not. Will a therapist know? No. Will a biller know? Honestly, no. It happens when that claim is sent out and then we get that rejection. Then that's where the clinical excellence team will come in to try to figure out how we can correct that and get it and let the therapist know.
Yeah, I think we would, again, it's so individualized to that individual case and, all the pieces of the puzzle, what state you're in, where you're providing, what the diagnoses are, who the payer is potentially. There's a lot more, what else is going on with them, because again, no one situation is ever the same. So I think we would need to know a little bit more about that. But I could see why you have questions, because you remember me saying it's a little bit gray, but we would just need a few more details.
Great. And thank you so much. And to anyone else who wants to ask questions, feel free to reach out to Stacie or Anne Marie. I'm sure they'll be happy to connect with you. But that concludes this episode of Clinically Speaking. So a huge thank you to Anne Marie and Stacie for sharing their expertise and helping us better understand how coding connects to quality care. If you're inspired by these conversations and want to grow your career with a team that values continuous learning and clinical excellence, check out SLP opportunities across Ivy Rehab for Kids at ivyrehab.com/careers. We're always looking for passionate clinicians who want to make a difference. And don't miss our next episode on Thursday, November 20th, where we'll be diving into the science and application of blood flow restriction therapy, another exciting tool helping clinicians take patient outcomes to the next level. Thanks for tuning in. And as always, keep learning, keep growing, and keep making an impact. Thank you, everybody.
Thanks for having us.
Thank you.